Today we are doing a dorsal rhinotomy in a dog that has a nasal carcinoma. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So this is a 10-year-old golden retriever. Has a history of a nasal discharge, right-sided, also sneezing quite a bit. And so we got it in a few weeks ago and did a rhinoscopy and a biopsy and confirmed that it had a nasal carcinoma. And so the treatment options that we have available to us, surgery by itself does not improve survival at all over conservative management. So surgery alone is not really an option. If you're going to do surgery, you have to follow up with radiation therapy. When you follow up with radiation therapy, you get a median survival time of about 2 years in our hands. We've treated about 40 patients in that fashion. The other alternative would be to do just radiation therapy with a linear accelerator. And with radiation therapy with a linear accelerator, median survival time is 12 months. Benefit is that you don't have to do any surgery. And the surgeries, look, it's not horrendous, but it is a pretty big deal. So, but by doing the surgery, you do get a significant survival advantage. So radiation therapy generally is going to work better on microscopic disease than it is on macroscopic disease. So if you can get the tumor down to microscopic disease with surgery, you're better off. So I'm just making a skin incision over the dorsal nasal region, and I'm going to do a unilateral dorsal rhinotomy. We're going to remove as much of the tumor as we can, recognizing that these guys bleed a lot. You really can't get the bleeding to stop until you've removed all of the nasal contents. So this is a complete, called nasal exoneration. So you're removing all of the nasal contents down to glistening bone in all directions. We don't replace the bone with anything. So one of the complications or side effects that we see with the surgery is that they commonly get subcutaneous emphysema, and so it's like they have bubble wrap underneath the skin. Alright, so I'll go ahead and start burring. Slow down on the fluid. Actually, you can probably stop for a moment. So this is over the frontal sinus here. I'm pretty confident the frontal sinus is just full of discharge and without any tumor, but there was definitely soft tissue in there on the CT scan, so you can't assume that it's not tumor. You have to go in there regardless. try to get the majority, go ahead and flush please. I try to get the majority of the bone down to very thin before I penetrate, because when we penetrate, it's going to start bleeding. So go ahead and drop into the frontal sinus, because that's less likely to bleed. And I'll extend my rhinotomy from there. Got a bigger kerosene. Can you see if you can get me a bigger kerosene, Ranjur?
Yep.
Thank you. See the boogers coming out already. So it'll be bigger than that.
Yeah.
Thank you. So once we start getting some bleeding, you have to really move quickly, because again that bleeding won't stop until you get all of the nasal contents out. And this bleeding that we're seeing here is nothing compared to what we're going to get in about 5 minutes. Not sure that suction is working. I can hear it.
Is that better?
Nothing, yeah. Are you getting it out of the wall? So pull the one that's coming from the wall and see if you're getting anything there. Yeah?
Is that working?
No. Yeah, there we go. So this is pretty gross. Can you get some flush, please?
Flush ready?
Oh. So not for the weak stomach. Just imagine how uncomfortable this would be for the dog. Almost elastic. It's like contact cement. Grab another lap sponge, please. And we'll go back to the other section tip. And we can flash a bit while we're sectioning.
Yep.
Okay, so that frontal sinus is completely empty. So no evidence of any tumor in there. And there's almost never tumor in the frontal sinus, but we still have to check every time. All right, so now I'm going to extend my rhinotomy. Before I start getting a lot of bleeding, so that I can get my instruments into the nasal cavity. Once I've committed to that point at which it starts bleeding, we have to work pretty fast. All right, so now, can we get a portable suction unit in here, please?
Yep.
I'm getting pretty close to the olfactory lobe up here. And if you're going to do this surgery, you really have to get it down to basically white glistening bone. It's just not suctioning very well. Thank you. Yeah, that is one thing with all the amazing equipment that we have here. Our suction is not great.
Pretty loud.
That's right. Might not be plugged in. Try going straight in the wall. Yeah.
There we go.
And we're starting to get to tumor here. So basically now, do you know where the Carmalt is? So that's all tumor there. Can I get a large curette, please? The bleeding that we're getting here so far is not bad at all. It's going to get worse before it gets better.
Thank you.
Where's that curette? So that's where the olfactory lobe is, right there. Grab that curette, please. No, that's right. Nice big chunk tumor there. Let's get some saline flush, please. Good. Yeah. So you guys can probably see the white glistening bone at the bottom there. That means that we've gotten all the nasal contents out. This is not bleeding very much at all.
Okay.
Awesome, thanks. That's right, hold on. Now I'm just examining, seeing if I can see any other soft tissue in there. So to reiterate, other than being diagnostic, a rhinotomy and removal of the tumor does not do anything for survival. As much as I hate to say it, as a surgeon, this is a non-surgical disease unless you've got radiation therapy to follow. Hemostasis. Glad we got that out. So now we've got this really expensive stuff called Surgicel, which costs several $100s, but we got it for free from a human hospital. Seems to be working nicely. Not sure if there's anything left in here, but the bleeding has all but stopped. So now I'll just get another lap sponge and pack that for about 5 minutes to make sure that we've clotted everything. Can you push code, please? Just code right there. Thank you. I'll give us a 5-minute count. And I'll come over and see if there are any questions that I can answer. So we've got Taiwan, British Columbia, can you slide up, please? India, Connecticut, and Piyush is also from India. So, and Piyush is coming to visit us, I think, next month. So it's exciting. He's been here already once for a couple of weeks, and he's coming back for another couple of weeks, I think. So anyway, we'll just wait for a few minutes. I'm happy to answer any questions about this that you might have, because I've got a break in the action. California, must be late. Oh, Egypt again. What time is it in California? It is midnight on the East Coast, which means 9 p.m. on the West Coast. And Surgicel is just cellulose, and so it just provides a substrate for blood clotting. It doesn't actually stimulate blood clotting, but it has such a high surface area that it promotes clotting. So, question about surgery plus ortho voltage compared to SRT. So, surgery plus ortho voltage, you get about 2 years. SRT, you get about 1 year by itself. If you combine SRT with linear accelerator, SRT with surgery, you can get even better survival. I think it's about 3 years. And the Surgicel is used for clotting.
I think we need to drop a little bit. I'm just from that bend and outline again.
Okay, you want to give a fluid bolus?
Yeah.
So give about 10.
Yeah.
So we're going to give a 10 ml per kilo fluid bolus. And we're at 2 minutes and counting on our stopwatch. The nozzle was stopped up, that's why it wasn't going on the Surgicel. So I've got a bit more here in case we need it. But I can't look for another 2 minutes. So I was reminded of a funny story while we're waiting. My middle son, who has come in and scrubbed in before, when he was about 2 years old, he was fructose intolerant and we hadn't diagnosed it yet, so he was really, really skinny, like his little butt. He was tiny. And so we were swimming in the pool and he said, as little boys do, I've got to go poo, like in a hurry. And so we ran upstairs and he was soaking wet and he was so skinny that he had to hold on to both sides of the toilet seat ring to keep from falling in on either side. So he's going to the bathroom, and then for some reason, I pointed my finger at him like a gun, and I said, stick him up. And I don't know why I did that, but anyway, he stuck his hands up in the air, and he slid into the toilet with his knees around his ears, and he squished the poo into the bottom of the toilet. And he thought it was the funniest thing he had ever seen. He was just laughing hysterically.
How old was he?
2 at the time, yeah. So the tumor that we're removing here is an adenocarcinoma. And so we've done biopsy previously, and now we've done we've done a marginal excision. We'll follow up with radiation therapy in about 2 weeks.
There's another question just about that. What does post-op care look like?
So post-op care, we've warned the owners about subcutaneous emphysema. And basically just restricted activity for 2 weeks, and then we'll come back and do radiation therapy from that point. So bleeding is pretty good. We've got a little bit there that hopefully we can control. It's just the smallest little drip. So the hemorrhage on this one is less than we often see. Let's get a little bit of flush, please. Thank you. Okay. All right, so I'll go ahead and get some 2O PDS, please. And you can't really close in more than one layer with these guys. You can try to do two, but if you do 2 layers, it sometimes bunches the skin up. Can you run that for me, please? While we're closing on them, do you want to do the post-op checklist? Yeah, the post-op orders.
Yep. Do you want to do the plan?
Yes, please. Yep.
Is there a peak list for this?
Yeah, just soft tissue.
Yep. 2 weeks exercise restriction?
Yep, so 2 weeks exercise restriction, and then just has to come back at 2 weeks to start radiation therapy.
Yep. Any NSAIDs to go home with?
Yeah, meloxicam.
0.1?
Yes, it's already on it, so.
Yep. For 7 days?
Yep.
Opioids?
Yes. Let's do a fentanyl patch.
Yep. 5 days. Any antibiotics?
Nope.
Any additional pain relief?
Nope.
So 7. Sorry, did you say 7 and 14?
Rechecks, just 2 weeks, I think.
With a senior intern or?
Senior intern would be great. Yes, please. So TPR is every 4 hours.
No bandage,
Nope.
no icing.
If it'll tolerate icing,
Yep.
that's great. I don't know if it will. We've got the sponge in the back of the throat also to take out.
Yep. Any additional blood work?
No. Let's do a PCV at midnight.
Yep. Normal fluid rate?
Yes, please. How's the blood pressure?
They come back up again.
Great.
Do you want to continue it overnight?
Continue what?
The fluid, sorry.
Yes, please.
And she's on a CRI.
Fentanyl, so we'll keep her on that overnight.
Yep, and then we'll put the patch on.
Yeah. Patch on now, yeah.
Yep, and you said she's already on loxapam.
Yes.
So we'll give her a dose tonight.
Yeah.
Any antibiotics overnight?
No.
And any sedation if she needs it?
Any sedation is fine. ACE is probably preferable to keep her hypotensive a little bit so she doesn't bleed.
Yep. And soft food?
Nope.
No.
Any food.
Done.
Thank you. So this is a 10-year-old golden retriever, female, spayed. History of nasal discharge and sneezing. Did a biopsy, confirmed a nasal carcinoma.
Are we going to remove a skin tag?
I did.
Oh, you did already. Too quick. Do you need any input from ECT or medicine?
No, we just need to take that sponge out of its
Yeah.
throat.
Okay, that's good.
So I packed the back of the throat so blood wouldn't go back and be ingested or aspirated. I have a rostral mandibulectomy today that I may live stream depending on where they put me. Okay, we are done. So, just check to see if there are any other questions. So just had a little bit of epistaxis, mostly just nasal discharge and sneezing. So if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone next time we live stream. And we will see you again soon.